the patient's body. In Shirodhara, oil is poured on the forehead of the patient in a small stream with the help of special devices. After the preparatory application of oil on the head and the upper part of the body, the patient is made to lie on his or her back on the dhroni, with the vessel for dhara hung 6 to 8 inches above the forehead. The warm oil from the vessel is then let out in a continual flow through a spout made of thread at the bottom. The flow of oil should be almost incessant for a specific period. A headband varti is tied around the forehead just above the eyebrows to protect the eyes and to direct its flow straight down through the temples. Takradhara is dhara with buttermilk. Here, herbal decoctions are mixed with buttermilk to get a new medicinal preparation. Herbs used in the decoction vary according to the disease conditions. In a 7-day treatment, the patient will be subjected to dhara only 3 to 4 times for about 20 to 40 minutes. The soothing effect of Shirodhara on the central nervous system alleviates stress and calms the mind, which in turn improves the power of comprehension and memory. Recent researches also show that this therapy induces vasodilation within the brain, enabling increased flow of oxygen to the brain, nourishing the nervous system. As the toxins have been trapped deep in the tissues and various channels of the body, it is not conducive to the well-being of the system to expel them at one go. This is why an elaborate process of detoxification is necessary. The Purva Karma therapies help loosen up the toxins prior to the main course of treatment. Sarvangadhara is dhara over the whole body. When the liquid used for dhara is milk, it is termed Kshiradhara. Usually, cow's milk is used for this treatment, though sometimes buffalo's milk is also made use of. In both cases, herbal decoctions are also added with fresh milk. At least 2 well-trained attendants are necessary to carry out this treatment effectively. The treatment is carried out in all 7 standard positions. Kshiradhara is recommended for diseases caused due to disrupted Vata humor. The process of pouring oil on the whole body with simultaneous massaging is called Snehadhara. It is of 2 types: dhara over the whole body except the head, and dhara over the whole body including the head. For a really effective Sarvangadhara, at least 5 people are needed to attend to the patient, but nowadays, usually only 2 people perform this therapy. Before starting the therapy, oil should be applied on the head of the patient. The patient is then made to lie on a dhroni, and 2 attendants each stand on either side. Nozzled mud or bronze pitchers, kindis, are used for pouring the oil, which should be kept warm throughout the course of the treatment. While the attendants pour oil with their right hand, they also massage the patient using their left hand. Dhanyamla dhara literally means a dhara or pouring of a medicinal liquid called dhanyamlam over the patient's body. Dhanyamlam is a sort of vinegar obtained from the preparation of various cereals, citrus fruits, horsegram and dried ginger. Cereals with highly nutritious starch content like navra rice or millet are used. The dhanyamlam is poured in a small stream over the patient's body from a nozzled pitcher, kindi. Diseases caused by the derangement of vata humor are treated with dhanyamla. Pirichil, which literally means squeezing, is a unique contribution of the Kerala tradition of Ayurveda. Here, warm medicated oil is squeezed over the patient's body from a piece of cloth that is periodically dipped in a vessel containing the unction or kuramba. The unction used here is slightly more viscous than that used in Sarvangadhara. Trained attendants under the supervision of a physician perform the treatment. The attendants squeeze the oil with their right hand and simultaneously massage with their left hand in downward strokes. The patient should be made to adopt the 7 standard positions so that no area of the body is left uncovered. Though it is actually a process of sudation used as a purvakarma preparatory treatment, it has also proved to be highly effective on its own for treating diseases caused due to the vitiation of the vata humor, especially pakshaghata, hemiplegia, paralysis, muscle spasms, and other degenerative diseases affecting muscles. Upanaha Swedam or poultice is the local application of medicated paste to cure pain and swelling. Herbs, seeds, grains mixed with vinegar, buttermilk, medicated oils or ghee are ground to obtain a paste. This paste is applied hot over the affected part of the body and is allowed to remain there for over 12 hours. Avagaha Swedam is yet another form of sudation. In ailments like hernia, painful urination, rheumatism, and certain other diseases due to deranged Vata humor, Avagaha Swedam is recommended. In this treatment, the patient is made to sweat while sitting in a tub full of warm, medicated liquid. The level of the liquid filled in the tub is up to one's navel and sometimes up to the neck.
Bashpa means steam. It is also a sweat therapy. Here, herbal steam is evenly applied to the entire body. Before starting therapy, the person is given cool liquids to avoid dehydration. Then she or he is made to lie down in a steam box on his or her back, and the entire body, except the head, exposed to the steam. It is important to maintain the normal temperature of the head.
The principles of Panchakarma were first formulated by the great scholar saints of yore, Sushruta and Charaka. Though they propounded to different schools, their disciples codified their prescriptions and thus evolved a common five-fold therapy of the Panchakarma. They include Nasya, nasal therapy; Vamana, emesis therapy; Virechana, purgation therapy; Vasti, therapeutic enema; and Raktamokshana, bloodletting. The Purva Karma usually takes 1 or 2 weeks, after which the toxins which have been brought to the gastrointestinal tract are easily expelled in the Pradhana Karma. The application of medical oils or powders to the nostrils is called Nasya. According to Vagbhara, nostrils are the doorways to the Shiras, brain. As a preparatory process, the forehead and the neck region of the patient is gently massaged with suitable oil for sweating. Thereafter, the patient is made to lie down on his back with his head slightly bent back. Warm oil is then dripped into both nostrils, which the patient draws in. If the Nasya therapy has been carried out effectively, Kapha-related toxins will be eliminated and the region nourished. The patient feels great relief in the head and clarity of the sense organs. Breathing becomes completely unobstructed, which gives sound sleep at night. Nasya is excellent for chronic sinusitis, headache, throat diseases, epilepsy, catarrh, migraine, voice constraint, eye diseases, and cervical spondylitis. Vamana is a purificatory process intended mainly for the expulsion of vitiated kapha. This is a painless, drug-induced emetic process. Vamana cures diseases like acne, asthma, arthritis, chronic cold, diabetes, and various other kapha disorders. Virechana is for the elimination of pitta-related toxins. The process of cleansing is carried out in the small intestine and other pitta zones. Here, drugs that stimulate bowel movements are induced for the expulsion of doshas via the rectum. The word vasti means bladder. Traditionally, the urinary bladders of animals like cows or buffaloes were filled with medicated liquids and used for enema. Vasti's effects are directly felt in the colon, the prime abode of the vata. With the application of a series of purifying and nourishing vastis, the morbid doshas and other toxins trapped for long in the tissues